Welcome to This Week in Urology. This week we're covering 7 notable papers spanning urothelial oncology, functional urology and reconstruction, and advanced prostate cancer and health services. Let's dive in. In urothelial oncology, systemic therapies are reshaping the management of muscle-invasive bladder cancer. In a Phase 3 trial, Galsky and colleagues evaluated perioperative Enfortumab Vedotin plus Pembrolizumab versus neoadjuvant cisplatin-gemcitabine in 808 cisplatin-eligible patients. At a median follow-up of 33.6 months, the estimated 2-year event-free survival roughly doubled the risk reduction, reaching 79.4% in the combination arm compared to 66.2% with chemotherapy, with a hazard ratio of 0.53. Overall survival at 2 years was also significantly higher at 86.9% versus 81.3%. Furthermore, pathological complete response rates more than doubled from 32.5% to 55.8%. Grade 3 or higher adverse events were more frequent, with the antibody-drug conjugate and immunotherapy combination at 75.7% compared to 67.2% with chemotherapy. While toxicity is increased, these survival and pathological response figures suggest a major shift in neoadjuvant standards for cisplatin-eligible muscle-invasive bladder cancer. Turning to functional urology and lower urinary tract reconstruction, recent literature highlights surgical refinements and diagnostic challenges. In the World Journal of Urology, Carricito and colleagues reported midterm outcomes from a prospective single-center study of 29 women undergoing robot-assisted artificial urinary sphincter implantation via posterior vesicovaginal approach for stress urinary incontinence due to intrinsic sphincter deficiency. With a mean follow-up of 38.1 months, complete continence was achieved in 86.2% of patients and social continence in 6.9%, with an overall failure rate of 6.9%. The mean International Consultation on Incontinence Questionnaire short-form score improved by a mean reduction of 16.5 points, and pad weights dropped by a mean of 670.5 grams. Despite a 37.9% rate of intraoperative bladder injury managed without long-term sequelae, revision-free survival was 93.1%, demonstrating durable midterm efficacy. In reconstructive urethral surgery, Yadav and colleagues published a systematic review in Urology, evaluating preoperative factors associated with surgical complexity in delayed reconstruction of pelvic fracture urethral injury. Analyzing 22 studies and 2,176 patients, the authors found that anatomical accessibility markers, particularly a proximal stump position above the lower pubic symphysis and MRI-derived stump geometry, are more strongly associated with surgical complexity than gap length alone. In non-invasive diagnostics, Kim and colleagues provided a narrative review and conceptual framework in neurourology and urodynamics, addressing the persistent difficulty of differentiating bladder outlet obstruction from detrusor underactivity in men with lower urinary tract symptoms. The authors emphasized that current non-invasive technologies remain limited by physiological overlap, anatomical depth differences, and abdominal wall noise, proposing a depth-aware multimodal transcutaneous testing framework for future prospective validation rather than immediate clinical use. Meanwhile, population-level health trends are shifting. Writing in Urology, Corsi and colleagues utilized the EPIC Cosmos dataset to evaluate nationwide vasectomy rates surrounding the Supreme Court decision in Dobbs v. Jackson. Comparing 38.9 million men in the pre-Dobbs era to 55.4 million in the post-Dobbs era, the study documented a persistent, sustained rise in vasectomies that lasted over 3 years. The demographic shifted significantly toward younger men under 40, moving from 25% to 55%, and unmarried men, moving from 12% to 18%. Interestingly, Democratic-leaning counties saw a 22% increase in eligible men undergoing vasectomies, whereas Republican-leaning counties saw a 7% increase. In advanced prostate cancer, treatment sequencing and trial design remain critical focal points. Writing in European Urology, Mortazavi and colleagues underscored the importance of post-progression care in metastatic hormone-sensitive prostate cancer. They argued that without guaranteed post-progression therapy in trial control arms, reported survival benefits may partly reflect undertreatment in control groups rather than true therapeutic superiority, highlighting the need for trial designs that incorporate planned treatment sequencing. Complementing this therapeutic discussion, Sheehan, Dare, and Focus authors in European Urology Focus outline the rationale behind the optimal PSMA trial, examining whether dose-intensified or fractionated dosing schedules of prostate-specific membrane antigen radioligand therapy can improve depth of response compared to standard 6-dose regimens in metastatic castration-resistant prostate cancer. If you only have time for one paper this week, make it the Phase 3 trial by Galsky and colleagues in the New England Journal of Medicine on perioperative Enfortumab Vedotin and Pembrolizumab in muscle-invasive bladder cancer. It establishes a profound event-free and overall survival advantage over standard cisplatin-gemcitabine, signaling a practice-changing evolution in neoadjuvant management despite higher rates of grade 3 or higher toxicities. Here are the key takeaways from this week in urology. Perioperative Enfortumab Vedotin combined with Pembrolizumab significantly improves event-free survival and pathological complete responses compared to cisplatin-gemcitabine in muscle-invasive bladder cancer, albeit with increased toxicity. Robot-assisted artificial urinary sphincter implantation via a posterior vesicovaginal approach offers safe, durable midterm continence for women with intrinsic sphincter deficiency. In pelvic fracture urethral reconstruction, MRI-derived stump geometry and proximal stump position better predict surgical complexity than gap length alone. Post-progression care pathways must be accounted for when interpreting survival benefits in metastatic, hormone-sensitive prostate cancer trials. Finally, nationwide vasectomy rates showed a sustained rise following the Dobbs decision, disproportionately affecting younger, unmarried men, particularly in Democratic-leaning counties. That's your roundup for this week in urology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.